This is special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
And welcome inside another edition of our special COVID-19 coverage on the Your Health podcast. I'm your host, Sean McMahon, and be sure to keep up with the latest coronavirus news and how it affects our community at cswestcentral.ca/COVID-19. You can always listen and subscribe to Your Health on all your favorite podcast platforms. And if you'd like to do your part in the battle against COVID-19, go ahead and complete the daily coronavirus survey. By doing that, you'll provide CS West Central Montreal with ongoing real-time digital data that'll help predict potential hotspots and improve the allocation of resources. Participation is voluntary and confidential. Once you start, you're not obligated to continue, but it would really help. And you can find it at cswestcentral.ca/COVID-19 survey. And that brings us to today's podcast, which is really all about information gathering. Because as the situation continues to unfold in Quebec, there's a pressing need to better understand COVID-19 infection and transmission in order to identify at-risk individuals, to protect them, and to improve treatment for the disease. The Fonds de Recherche du Québec Santé, the FRQS, just launched the Quebec COVID BioBank, a province-wide initiative to enable the collection, storage, and sharing of samples and data related to the COVID-19 crisis. Well, the Jewish General Hospital is participating, and Dr. Brent Richards is right in the middle of it all, and he's our guest today. Dr. Richards, hello, how are you?
Very good. How are you doing, Sean?
Doing great, thanks. You must be thrilled to be part of a project like this. You're a genetic epidemiologist at the Lady Davis Institute and endocrinologist at the JGH. Going to talk about how the biobank works in just a sec, but first, the obvious question on everybody's mind, when are we going to get a vaccine for this thing? Do we have any answers for that?
We are not going to get a vaccine for quite a long time. Vaccines are traditionally very difficult to make in the best of circumstances and have been very difficult to make for coronaviruses in particular. So I think that a vaccine is obviously what we need, but it is something that we're going to have to wait for. What will be coming online, hopefully in the shorter term, is actual medications which decrease the complications related to COVID-19 infection. There are multiple randomized controlled trials being undertaken both here in Montreal as well as around the world to try to give us better data to understand if any of the medications that we currently have on the market are helpful for treating COVID complications.
So for the average person, when they hear the term COVID-19 BioBank, what exactly does that mean? What's being done? What does this actually represent?
Yeah, so in order to be able to treat COVID properly, we need to understand some fundamental things. We need to understand why some people are predisposed to having very serious infections and some people are not. One of the ways that we can do that is we can create a biobank. What's a biobank? A biobank is really just a collection of biological samples and data on people who get sick as well as people who do not get sick. And by using the biological samples from which we can look at DNA, we can look at proteins, we can look at various biological factors, and we can also, in a healthcare environment, extract all of their data within their electronic medical record. And we can start to compare the people who get very sick with the COVID infection to people who get COVID infections and don't get very sick. And when we make those comparisons, what we can do is we can start to define what are the particular things that we need to target with our drugs so that we can decrease the probability of somebody getting a COVID-related complication.
Now, in terms of the structure of the biobank itself, this is a province-wide initiative. How does a multi-center collaboration enhance the ability to gather all this data? Because the amount of data must be absolutely overwhelming.
It is a lot of data. So, we're collecting genetics on these people, so that generates hundreds of millions of pieces of information per person. We are expanding this across the province, and by doing so, we gather collective resources, and that enables us to increase the number of people that we can study. And when we do that, we can start to see signal arising from noise. One of the main problems in understanding disease causation is this problem of identifying what the true causes of the infection or the infection-related complications are against the background noise. And the best way to overcome that is to really just to look at a lot of people. And just to give you an example, usually it takes about 18 months to put together a biobank. So you have to go through complicated ethics protocols, different biological specimen procedure protocols. Just by working together and almost around the clock, we were able to get that done in 2 weeks.
It's really unbelievable. I have to ask you this, the final question, because, when people are faced with the unknown, and that's what a lot of this whole pandemic, I think, is revolving around, for the average person especially, people look for information to try to comfort their fears. They want answers. And as you mentioned, groundbreaking research doesn't happen overnight, but I suppose there's probably nothing wrong with having a little bit of hope. So what do you say to those who are looking to have just a better understanding of what we're all up against?
Yeah, so that's exactly right. So having some information as to just simple numbers that we don't understand. If I get a COVID infection, what's the probability that I will actually end up in an intensive care unit? If I get a COVID infection, what's the probability that I even have any symptoms? And in fact, there's some data that has recently arisen from China that 85% of people who seem to have been previously infected had no symptoms. And so just giving people in the short term, even without available therapies, giving them a sense of the odds that they're up against and accurate odds can really, and I think particularly in this instance, decrease a lot of that anxiety, because I think it will become apparent, and we don't know this fully yet, but I think it will become apparent that there's many more people infected than we think there are, and that most people have done very well.
Dr. Brent Richards, thanks so much for taking the time to shed a light on all the important work being done, and really appreciate you being a guest on the Your Health podcast.
It's really my pleasure. Thanks for taking your time.
You've been listening to special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Don't forget to subscribe at cuswestcentral.ca/podcast or on your favorite podcast platform.